The UK coronavirus cancer monitoring project started as an idea out of the University of Birmingham with Professor Gary Middleton and Professor Rachel Kerr from Oxford joining together to come up with this idea, supported by a significant team in terms of data and analytics team at the University of Birmingham. I got involved when we wanted to start turning the concept of a monitoring project into a reality in terms of networking. So the aims behind the project is to basically connect as many centres, cancer centres within the UK that we possibly can, and keep a registry of all of the patients who have a diagnosis of active cancer. So either they still have cancer at the moment or they've received treatment for cancer in the last year, to understand and gain more knowledge about coronavirus in this very special population. The data that we have so far from the countries that have had coronavirus before us is quite limited in terms of the impact on cancer patients and their potential risks. We know that patients with cancer have been told and are considered to be in a high-risk vulnerable group, but understanding what that looks like in terms of different types of cancer, different types of treatment, and various other elements in terms of their cancer diagnosis and their sort of well-being is a little unclear. So the idea behind the project is to try and gain as much data as we can, as quickly as we can, to try and inform our decisions that we're making around the cancer care in the UK during the coronavirus pandemic. I am chair of a collaboration called Notch, which is the National Oncology Trainees Collaboration for Healthcare Research. And ultimately, we have a network of centres across the UK collecting data and doing real-world data collection. So I was approached by Leonard Lee, who's one of the project leads in Birmingham, to see if we could use the network that I have of registrars around the country to try and start building this centre network, for example, to then become a reporting network, which we've now done. So we started just around 2 weeks ago. Recruiting centres, we have a standardised protocol and various other things. We have an electronic e-data platform that centres can log into and upload their information, and all of the relevant permissions and approvals are in place for it. And we now have 43 centres online, with another between 10 and 15 interested at the moment, collecting data around patients who have had a diagnosis of coronavirus in this period of time. We're collecting data since January 2020 of all patients with a cancer diagnosis who have had coronavirus, to try and understand more about it. There is. So we have set up a second arm of the study. So the project was initially around adults with solid cancer diagnoses, but we now have a partnership within the project which is looking specifically at paediatric cancers, and that went live this week. And we've also had many discussions about how we record hematological oncology diagnoses, so blood cancer diagnoses, and we are also setting up a hematology arm to the project so that we can capture data for those patients as well. It's actually really easy to get involved. So there's a few steps to the process. So the website, which is available through Google, you can go onto the website and put an expression of interest form on there. So that will come through, and you'll be able to download an expression of interest form, which will be about the centre, and there will be a lead for the centre. We call them IRIs. And once that form is completed, it comes back into us within the project. We then will send you the most up-to-date protocol for the project, various approval letters, and an invitation letter for you to gain local approval. Once you've gained local approval, there is a centre activation form which gets emailed back to the project, and from there you get your centre gets activated on a platform which is easily accessible from anywhere. So people that, if you've got data managers working from home or from NHS centres, either is fine, and you can then access the portal to upload your data. So it's actually really, really easy. We'd be really keen to get as many centres involved as we possibly can to improve the richness of our data. So We have started looking at the cases that have been reported. I think it's really worth saying that there is a real need and thirst for data in this area. And so what we need to do is make sure we have sufficient numbers of cases to be able to be drawing appropriate and actually valid conclusions. So we've spent a long time as a team discussing when is the right time to start analysing data and looking for trends. So we have got a reasonable amount of data underway now, but we have made the decision that we want to get 100 cases reported before we start pulling data that we then lead any insights into. We're not that far off. We suspect that we'll have that data by the end of next week. And obviously, the more centres that join, the quicker we'll get to that target. But I think we were very anxious about the fact that we didn't want to start releasing data before we had enough to make it valid. So we're nearly there, and hopefully we'll be able to have some initial findings very soon. But we haven't released any formal data yet because we want to make sure it's valid and telling us the right information. Cancer care at the moment is very challenging. The key to all of this is keeping our cancer patients as safe as they possibly can, and also trying to work out how we can manage their cancer effectively whilst not putting them at more risk. So it is a really challenging time for cancer care, but I think it's really important to stress that caring for our patients is of utmost importance, and there's a lot of work going on behind the scenes to work out how we can deliver as much treatment as possible and also maintain as many surgical procedures and various other interventions as possible. It is true to say that at the moment we believe that people with cancer and people on treatment for cancer are at higher risk of both contracting and having severe outcomes from coronavirus if they were to catch it. So we are in a really difficult stage at the moment where we're balancing those two features to try and get the best outcomes for as many people as we possibly can. But it has meant that we've had to really think about quite carefully how to navigate that, and particularly in cancer care, that's been a real challenge. And certainly many different groups around the country, including national directors for cancer and various cancer groups, are really working together to try and get us to a position that we can give as much treatment as possible in as safe as environment as possible. But it's really difficult without being able to quantify what the risk is, and that's the whole point of this project, to try and furnish that information and be able to allow us to make much more informed decisions, because at the moment we've got very limited data to go on, and that's quite a difficult place to be. We're really keen to get as many people involved with this project as we possibly can, so that we can start pulling conclusions that will help inform us and also help us design services and mean that patients get the best care we possibly can whilst mitigating their risk as much as possible.